Hi, my name's Savannah, and for my Healthcare 3101 presentation, I wanted to talk about how the truthiness really is that Canadian healthcare is actually not free. I had a brutal realization that made me come to this belief, and I'll tell you what happened. Let's talk about my personal experience, but first, what is truthiness? Truthiness is something, and a concept that you could say is when you believe something to be true because you hear it so much through TV, any type of media, people telling you, school, political conversations, things like that make you believe something's true just because you hear it. You don't do any further digging because it's just something you always thought to be true. But I recently had a rude awakening. I went to go get diagnosed with ADHD, and the doctor told me that it would be up to $1,000 to $2,000 out of my pocket to get this diagnosis with my insurance coverage with the school. I was pretty upset by this because I always thought, why do I even have to pay for this? Healthcare is something I shouldn't have to pay for. Healthcare in Canada is free, unlike the US. I always saw them with the hefty costs on movies, TV. I've even heard it from people. But in reality, this happens in Canada too, and it's something that we need to talk about. Next, let's talk about how this belief is reinforced. First, let's start with the Canada Health Act, which I just mentioned. The Canada Health Act actually states that only medically necessary services are funded through Canada, and these are seen as visiting a physician at the doctor or going to the hospital for medically necessary hospital visits. Next, the Library of Parliament states that Canada Health Act does not require full coverage for all healthcare services, only specific ones that I just mentioned. We also have this furtherly reinforced by the Canada government, which acknowledges that healthcare isn't actually free. It's actually funded through taxes paid for through Canadians. So we are paying for our own healthcare at the end of the day. And lastly, the Canadian Medical Association goes even further by saying Canadian healthcare is a myth. That really tells you something about our system. To further understand this, let's talk about what's the truth and what's the misunderstanding. The truth is that Canadian healthcare isn't paid for from the government. It's actually paid for through our tax dollars that we do end up paying for anyways. So the Medical Association wasn't so wrong when they said that it's a myth, because we are actually paying for it, just not directly. The misunderstanding is that when people hear Canadian healthcare is free, we assume it for what it is, this broad statement. But when you dig deeper, it's only those medically necessary services that are actually free. And are they really free because we are actually paying for it through our tax dollars? The things that aren't paid for are our dental care, prescriptions out of the hospital, health support through mental health, which is what I had the realization through ADHD. And these are paid for out of pocket directly or through private insurance companies, which a lot of people get through their jobs. Now, why does this matter? Well, this matters because it can expose these real gaps that are hidden in our system when we believe these things that are not true and we don't do any deeper digging. When we don't look deeper into these things, the healthcare system can hide these areas that we overlook that actually do need improvement, but we don't really see that because we're hiding behind these statements such as Canadian healthcare is free, and we think we have the best healthcare system, maybe because we are beside the United States, who have to pay for everything out of pocket and don't have the best healthcare system. But Canada's healthcare system still probably can use some developments, and I think something that's very important is us being more realistic about where things come from, because it can lead to people having these unexpected, insane, and necessary expenses such as like dental surgery, mental health, seeing a physician, seeing a psychologist. All these are extremely expensive things that Canadians might not be prepared for. Now let's wrap this all up and conclude. In the end, the idea that Canadian healthcare is free is a powerful example of truthiness. This is something that we believe as true because we hear it so much. But through my own personal experience, I can say that it's not true, and the Canadian Act and other sources help reinforce and back this up. I've learned that healthcare is not completely free, and it's actually publicly funded and only for specific services. And I think that this is an important thing that we need to tackle because it does hide gaps that are extremely overlooked in the system and that we could better understand and recognize. I think we need to think more critically about how it can be improved, and I think this is by being more honest about the true healthcare system. Ultimately, confronting truthiness helps us move beyond assumptions and towards informed evidence-based thinking. Thanks for watching.